Welcome, everyone, to the 2020 Raleigh Chamber Virtual Healthcare Forum. I know some of you are still joining. Don't worry, we will have plenty in this fabulous lineup for you throughout the program. My name is Lena Tillett, and I'm an anchor and reporter at WRAL News. If I can borrow from our new pandemic language, I'm kind of in a hybrid shift right now, anchoring in the morning and also in the evenings, but in a couple weeks I'll be anchoring totally in the evenings. I actually like to call what we do now as journalists, we are daily recorders of history because nearly everything we cover these days has just never been seen before. And frankly, I hope that we can retire the word unprecedented with this when this pandemic is over. Um, but I can't imagine doing this work with a better group of journalists at WRAL. I'm the new kid on the block. I've been here 4.5 years, but we have people at WRAL who have been here for decades. And when I was deciding to come to WRAL years ago, it was really interesting and kind of odd when I was first coming here that one of the biggest selling points of Raleigh and the Triangle was its phenomenal healthcare systems. Um, and now, I don't know about you all, but I'm so grateful to live in this community with this level of brain power and research and expertise during this pandemic, during this moment in time. So, on behalf of the Raleigh Chamber, we're so glad you're with us today. You are going to get to hear from our state's leading experts as we discuss the new state of healthcare. I'm sure it is renewing every single day as a result of this pandemic. But we're going to be asking these experts what their vision is for healthcare during this absolutely extraordinary time, how innovation can take the industry forward. I know that our experts and healthcare professionals are basically in a perpetual state of problem solving, and we're so grateful for all they do. And we're also digging into the economic benefits that this industry brings our community. So in the past, the business approach to healthcare focused a lot on cost controls through employee wellness and healthy workplaces. You've heard us talk about that. But today we wanted to focus on the impact of technology and innovation and integration with all in all areas of healthcare. And we're also looking at how employers now have to support their workforce during these difficult times. Business investment in affordable healthcare options in the 21st century is more and more vital as the private sector is looking to ensure the health of their employees now. Healthy and safety initiatives in the workplace, it's an absolute must for businesses, both large and small. So these are some of the issues that we're going to dive in today. And again, we have the absolute best minds to take us through it. Before we begin the program, the Raleigh Chamber would also like to recognize and thank the sponsors for today's forum. Our presenting sponsor is Gallagher. Carol Wagner and Pat Wilkins, thank you so much for your continued support of this event and also of the Raleigh Chamber. And also joining us as a presenting sponsor is Wake Med Health and Hospital, also Duke Regional Hospital. Thank you to our healthcare systems for sponsoring the event. Our platinum sponsor is Curie. Thanks so much to Curie. And our gold sponsors include Blue Cross Blue Shield of North Carolina, First Citizens Bank, and United Healthcare. Our silver sponsor is Messer Construction Company. Our bronze sponsors, Baker Roofing Company, Young, Moore, and Henderson. And to my employer, our media sponsor, WRAL, is the official media sponsor. So if you could give us a virtual round of applause to the sponsors, that'd be wonderful. Now I would like to invite Carol Wagner, Gallagher Area President, to join me on screen and provide us a welcoming to talk about Gallagher and its role in our community. Carol?
Thank you, Lena, and a warm welcome to everyone attending the Healthcare Forum this morning. On behalf of our entire Gallagher team, it's a pleasure to be here addressing this important topic of healthcare and overall well-being of our employees and the citizens that live, work, and play in this greater Raleigh area. You've heard the quote, life is 10% what happens to you and 90% how you respond to it. Well, 2020 happened to us. But at Gallagher, in the human resources and risk management business, I'm encouraged every day by our clients and their response to this unprecedented, yes, Lena, one more time, unprecedented event. And today you'll hear from select employers who will share their response to the pandemic and how they're moving their companies forward. And that's where Gallagher steps in. Our approach with our clients is to look at the whole person, their physical and emotional health, the financial well being, and career well being, in developing a total reward strategy that attracts, retains, and engages the workforce so employers like you can meet all your business objectives. And I don't recall a time where there's been a crisis that has impacted our employees on all fronts like this pandemic has. But never fear, you are not alone. We are here to help you, and you're going to get some great tips and advice from employers in our community today. So thank you for joining. And Lena, back to the program.
Carol, thanks so much. We can use unprecedented until I guess unprecedented stop happening. So we'll
Good.
figure out when that is. Carol, thanks so much. It's really exciting to hear the wonderful work that Gallagher is doing. By the way, we want everyone listening to get involved as well. I want to make sure that I tell you all this. Share your thoughts, takeaways, whatever you're learning today by using the hashtag HCForum20. You can also follow us on Twitter at Raleigh Chamber. Also, the recording of this presentation is going to be shared after the event. We invite you to engage with the speakers and panelists using the chat box, which I just learned how to use. Webinar has a very handy chat box that you all can utilize. Now we are incredibly excited to kick off the forum by welcoming the Secretary of the North Carolina Department of Health and Human Services, Dr. Mandy Cohen. Frankly, she needs no introduction because she's been in our living rooms, at our kitchen tables for the past 9 months. So thank you so much for joining us, Dr. Cohen.
Well, thank you, Lena, and good morning, everyone. Great to be with you. I'm glad, Lena, you and I got the red memo for this morning. So great to be with you. And I know we have a few minutes here, and I want to do a couple of things. I think this is actually a really important and critical time for us to be having this conversation. But I want to talk about what's happening right now, but I also want to talk about a few of the lessons learned as I try to sort through, as we said, this unprecedented time, and where do we go from here as we look forward to 2021. But as we sit here, a week or so before Thanksgiving, North Carolina is on very shaky ground, and I'm concerned as we head into the holidays. Later today, you will see we will add yet another day of 3,000 more cases to our caseload. So we are at like the highest clip of new cases that we have seen since the start of this pandemic. The percent of tests that are coming back positive is creeping up. We are still below where we were back in the summer, which is good, but we have just week over week been increasing. But probably the most concerning to me, and I'm sure you're going to hear more from our hospital leaders, is that we are seeing more and more hospitalizations, and it is accelerating more rapidly than I would like to see. I'm particularly watching the Triad area. They are increasing in their hospitalizations fastest, but that does not make us safe here in the Triangle by any means, because we're all in this together. And I actually am so appreciative of the hospitals and the frontline healthcare workers. They've been amazing through all of this. They've really been planning and preparing, so we are ready to handle this surge. But there is only so much capacity any one state has or any one hospital system has, and we have to protect that capacity. What I see in other states happening right now, I was just reading a sad report about what's happening in the Dakotas, in Wisconsin, with the fact they have to ship patients out of state, fly them out of state if they can even do that. They are setting up field hospitals, which we know is not ideal under any circumstances to handle care. But North Carolina has been able to avoid the worst of this pandemic so far. We avoided that first surge back that the Northeast had in the spring. We avoided the huge surge that the South had over the summer. I want to avoid what I see as the worst surge coming, as all the trends are pointing in the wrong direction across the country. And North Carolina is getting worse, but luckily we are not accelerating in the same way some of those other states are. But this can get away from us so quickly. And that's what I've seen in other states is they go from, inching, and I'd say we're more than inching, we are increasing, but they move to that exponential growth or that acceleration so quickly like that and jumps on you that we have to be really careful. So you're going to see some additional information and recommendations from my department and the governor later today. But overall, we know what to do here, right? It's not new things, right? It's still wearing masks, it's being socially distant, avoiding large gatherings, and washing hands, right? It's the 3 Ws, and I'm really requesting that everyone in North Carolina, and particularly our business leaders, use this moment to role model, to lead, to pull together as a state so we can weather the coming months, because I do think that they are going to be tough months for us here in the state and around the country. So we're asking folks, for example, for Thanksgiving, to keep it small, keep it outside, wear masks all the time, and consider a test ahead of time. So I'd really love if you can promote those messages to your employees and role model those as leaders in the community. Of course, promote the 3 Ws, but particularly for Thanksgiving, keep it small. I had to adjust my Thanksgiving plans. I was hoping to, visit family. That's just not going to happen this year, and I'm honestly really upset about it. And I know how hard this is, but we've got to keep it small, keep it outside, masks all the time, and consider tests ahead of Thanksgiving. So we have a lot of work to do. I do want to say there's hope at the end of this tunnel, right? We had good news this week on the vaccine front, yet a second vaccine with preliminary data showing effectiveness of the vaccine. Now, I want to see a lot more of that data. Data by press release is not my favorite, but I'll take hope where hope where there's hope. And so I do expect, given the pace of them showing those interim results, and hearing from some of the executives at the companies that we could have vaccine as early as the last week of December, first week of January. Now, that supply is going to be limited. And so we're going to be vaccinating frontline healthcare workers, our long-term care facilities, starting with adults that are at highest risk from COVID, obviously older adults, those with chronic diseases. So before it is widely available, we're going to be into the spring before this vaccine is widely available, which is why the tried and true 3 Ws are going to be with us. But that is really hopeful news on the vaccine front, and a triumph to the scientific community, and frankly, the Triangle area contributed to that. We do have I'm grateful to the amazing tech companies and scientific life sciences companies that are here in North Carolina. It's really impressive work. But again, I want to see that data. They got to go through that process of the FDA transparent process that we need to get through. But it is certainly hopeful news. In the second half here, I just want to talk a bit, so things are not great in the moment, but let's talk about what are some of the lessons early on that we're learning, and where do we go from here in terms of 2021? I think there are 3 things that I have been taking away as big buckets of things as we plan for the future. And they're not really big, sharp turns of things you've heard me say before. I've been in North Carolina now almost 4 years in January as Secretary of Health and Human Services. And it's a lot of the same themes, but I think COVID for me has kind of really put a sharp point on some of the things we've already been doing. And the first one is really connecting to the theme of this conference, which the first is about health beyond walls. We need to think about health broadly. Health is no longer just about going to see a doctor like myself, going to a doctor, going to someplace with walls. We know that telehealth, using our phones, using our screens to connect, to get access to care is this next frontier. And gosh, if we are still calling it telehealth in 5 years from now, as opposed to just another way to access healthcare, I'm going to be disappointed. No one calls it telebanking anymore, right? So it's just banking. So I'm hopeful we will move to this just being part of how we access care. And I'm hoping that this COVID crisis has accelerated the adoption of telehealth. both at the patient level so that they're more comfortable accessing it, as well as docs and nurses and others rearranging their workflows to adopt telehealth into their practices. I think that's a game changer, particularly for areas with lower access points right now, like rural communities. But we need to have broadband infrastructure and all of that. But health beyond walls is more than just telehealth. I think it also is a reminder that health is more than just an interaction with the medical side of things. I've been preaching this for a while about how we need to link together our healthcare system and the community organizations, because we're seeing so much more that housing and food access and transportation and your job all contribute to your overall health. And we as health leaders need to be thinking about that global picture, because at the end of the day, we're in the business of trying to create a healthier community, a healthier state. And so we need to think about health broadly, both using technology to do that, but really thinking about outside the walls of hospitals and clinics to the other things that drive health. NC Care 360 has been a really important new platform that we've created to try to bring together those worlds. And again, another technology innovation that I think can help us. So health beyond walls is the first takeaway. Second takeaway for me is a focus on equity. I think COVID yet again shone a light on the fact that that we have serious health disparities that are pervasive, and COVID only shone a light on that. And we know that the health disparities are from long-standing structural inequities, both in our own healthcare system, but beyond, right? When folks are not getting access to the care they need because of where they live, the jobs they have, the educational it all wraps together. And we, again, as healthcare leaders, I think we've been getting better at measuring the disparities, but I think we've been doing too much of I would call admiring the problem, like looking at the problem, knowing it's there. It's time for us to move beyond knowing it's there and knowing we need to do something about it to taking action. And that's one of the things we've tried to do as a state as we use our COVID response and recovery. We've definitely made a lot of resource allocation decisions based on impact on our historically marginalized communities. And I think we need to do that across the board in healthcare. And I think we have to examine ourselves within healthcare about our own biases and our own way of how we are interacting with our patients, how we communicate, how we follow up, everything. So equity is certainly a second big lesson for me. And then the third is around systemness. And I actually think they relate to the health beyond walls and equity. It's systemness. It's the fact that as we started to respond to this crisis, it was so evident how siloed we were and how unready we were to share data across systems and how unready we were to work together as a system. Now, we've gotten so much better at it over this very painful year, but let's not create that pain for us. There's so many ways in which building for systemness and that interconnectedness, whether that's sharing of data or the understanding that we're all trying to help that same family, but in different ways. But how do we do it in a more coordinated way so we get rid of the waste, but also are more efficient for that family? So that we think about systemness differently. I think technology certainly has a role to play in that efficiency, like in bringing us together as systemness. We got to get interoperability and data sharing right. I think that's critical. So as I think about our response to the pandemic, when at the beginning we just didn't even have a way to collect some of the data we needed to drive decision making around lab testing data, around hospital capacity understanding. We've matured that, and I think we want to build on that going forward. I also think of going back to NC Care 360, another tool for systemness, for health and systemness that we accelerated the adoption of across the state. I'm really grateful. I know Wake Med's going to be on the panel later, one of our first adopters of embedding NC Care 360 within their workflow. I know Duke is doing that as now, UNC and many others. So I'm grateful for the medical community recognizing the important role that they play as connectors to not just the healthcare piece, but again, that broader health lens. So those are my early lessons: care beyond walls, and thinking broadly about health, the equity piece, and us needing to move beyond just measurement to action, and this building for systemness, and so that we are truly interconnected, and build for that efficiency, and whether it's to respond to a pandemic or really just to deliver great health for our state. So those are the things that I'm thinking about as we move into 2021. But I'll say it's really hard for me sometimes to do that, because I'm just focused on this next week of trying to protect North Carolina as we head into Thanksgiving here. So thanks for all you are doing. This has been a tough year, I know, for so many, economically, emotionally, physically, mentally. Like, it's been just that year, and it's been really, really, really hard. And I'm just grateful for everyone. Stick with this. I don't want to fumble the ball at the 5-yard line, right? There's light at the end of this tunnel with the vaccine. We've done 8-9 months of really hard work as a state. I don't want to see us overrun our hospital capacity at this point. So we need to work hard right now. So stay tuned for some additional new recommendations and data from our department later today, from the governor and myself. But it never strays from that core 3 Ws of, like, wearing a mask all the time, and really avoiding gatherings. We're going to have to really buckle down on that. So I'm just appreciative of that. Oh, and get your flu shot if you haven't already. We're all excited about the COVID vaccine, but there's a vaccine you can get right now to protect yourself. So get your flu shot. All right. With that, Lena, I will turn it back to you. And I know there may be some questions.
Yeah, so please, everyone, submit your questions in the questions tab for webinar. I have 50 questions for Dr. Cohen, but I will only ask a couple. So I want to talk about the good news first. We are very excited about this news from Pfizer and Moderna. Incredible effectiveness coming out of this early data from stage 3 trials. So that's at least positive. And we're focused a lot on the problem solving of healthcare systems. You were talking about systemness, how through I'm sure, some rough early months, and then you all were able to communicate better and share data better and share information better, share therapeutics and research. So I'm curious about vaccine distribution. What, in terms of a plan, do you have now for vaccine distribution? How are you utilizing technology and innovation to try to get this vaccine to millions of Americans, both high risk and then everyone else? How are you all thinking about all of those major challenges? Because I know it's very positive that we're getting this news from Pfizer and Moderna, but the next huge challenge in front of you is actually getting it to us. So how are you factoring innovation and technology into getting it to us?
Sure. What a great question. And we're thinking about it a lot. So one, we did have to put together on paper our plan for all of the logistics, and how we would do the distribution that we had to submit to the federal government. That is public on our website if anyone wants to, need some bedtime reading. But, essentially there's 2 buckets of activity. One is just the sheer logistics of moving the vaccine, getting it to the right place, getting it to making sure we have the infrastructure of people who actually will do the vaccinations. So, and then it's the tracking, right? Then it's the data piece and the technology, because this isn't going to be just one vaccine, it's going to be 2. So we are going to have to make sure to know who got what at what time in case they go to a different site and location. So let me do the logistics piece first, because there's some complications. So with the Pfizer vaccine, which seems to be just a few weeks ahead of the Moderna vaccine, it requires ultra cold storage, which is not something that is everywhere. So that just adds a logistical hurdle to as we were thinking about it. So, for example, we were asked to identify 5 sites across North Carolina that could do the ultra cold storage in a geographically distributed way, so we could pre-position vaccine as soon as they start to go through the approval process. So from there, we have a distribution system to our hospitals and local health departments. They are going to be the first vaccinators, if you will, because of who is going to be vaccinated, right? It's going to be healthcare workers and other high-risk populations. So it is really going to be our local health departments and our hospitals. So we have already, for example, enrolled all of our hospitals, all of our local health departments to be vaccinators. We're already working on training and making sure we have the supplies to be able to stand up the kinds of units. I think at first they will not be mobile units, but that will be the intent sort of within weeks to be more mobile, to put up vaccination sites that are more mobile. Then on the IT side, we are actually building and implementing a new IT system for vaccine tracking for North Carolina. We had the ability to connect into the federal system, but as folks may know, I served in the federal government when we ran healthcare.gov, and that didn't go so good. And so I have some PTSD from linking into federal systems. So I was like, we're gonna do our thing here in North Carolina, and I think it does. Joking aside, I think it gives us the ability to have flexibility with that platform. But it was another place where we weren't built for systemness leading into the vaccine. We do have a vaccine registry, which is great, but it didn't have the functionality that we needed as we went into this massive vaccination effort that we know we were undertaking. So we have to build something new. And it's good that we're building something new. I think it's an investment for North Carolina going forward. But it's a lot. It's a lot of newness in a time where we're trying to execute on a lot of fronts. So a lot of work, getting briefed on it almost every single day to make sure that we are staying on track for that. But a lot of work to do. And I want to thank in advance all of our healthcare providers out there that are going to be the vaccinators as we start this work. We will work on the distribution, but it will really be them that are doing the heavy lift of doing the vaccination.
And who is creating that system, that this all, I'm assuming, completely new system of
Yeah.
recordation of vaccinations?
Oh, I lost your audio, but I think you said who is creating that system. So we are building it with a vendor. Luckily, this is
Okay.
an off-the-shelf kind of product. A number of other states are using it, so we were able to look around and see what other states were already using and bring it here. It's luckily nowhere near the complexity of a healthcare.gov that happened at the federal level. So right, it's a tracking tool,
Okay.
and what it will do is give us the ability to embed it ultimately in our electronic health records. If we had used the federal system, we weren't going to have that ability, but ultimately this is going to be a long effort. We're not just vaccinating folks for 3-4 months here. Like I expect that this will be a long effort, and we don't know yet, but I expect this may need to be like a flu shot where we're doing it on an annual basis as well. So this is a good investment for North Carolina going forward.
All right, we have a couple questions. Someone asked exactly what I was thinking, and I think that's a concern for a lot of us. Are you concerned that vaccine prospects could promote riskier behavior?
Mhm. Oh, it's such a good question. Yes, I mean, yes. I think that I am already worried that folks are completely over this this virus. They're tired. They've had it. So I'm worried about that. And then they see, oh, the vaccine's going to be here. Plus, as I think folks need to remember it's going to be in limited supply when it is first here. So I'm really trying to have folks understand. I think we are well into the spring before this vaccine is widely available. So the masks are going to be with us until then. So we really, really, really need to be vigilant with those activities.
Another question, out of hospitalizations that you're seeing right now, are you seeing precautionary admissions, people with pre-existing conditions who are at risk for more severe complications and might be going for precautionary reasons?
Well, so I think that's a good question to ask our hospital panelists that I know are coming next. But I have been hearing from the hospital CEOs is that the acuity, meaning the how sick the patients are, is actually going up. So these are sick patients that really need to be in the hospital, and so I don't think that these are precautionary admissions. But the hard part about COVID is a patient can be looking pretty good, maybe just needing a little bit of oxygen help, and can get really sick really quickly. So I think that one person's precautionary admission is another. We need to watch you very closely because you can get very sick. So I think that is obviously a clinical judgment that I leave to the doctors that are making those decisions. But unfortunately, what we're seeing is about 200 or so new admissions day over day, and that's very worrisome. That is definitely an uptick from where we were in terms of admissions even just a week ago.
A final question for you based on something you said that I was really struck by. So I know that you talk a lot about healthcare disparities and unequal access to care. And when you talk about systemness, I'm, I wonder how systemness can be applied to getting information to communities.
Mhm.
What
Mhm.
have you learned over the course of 9 months in terms of information silos and how
Mhm.
you all have to work very hard to get accurate information to different communities so that they
Yeah,
can protect themselves?
yeah, Lena, such a good point because sometimes these can be in tension, right? If you create more systemness, you structuralize the disparities, right? You actually are, if you're not careful, if you build for systemness in the way we've always done things, right, you can actually make the equity issue worse in your effort to try to systematize everything, right? And so we've had to work very intentionally against that. And it starts with recognizing that the disparities are there. And I think it's really important for healthcare leaders to acknowledge the systemic racism in healthcare itself, but more globally, because if we don't recognize our own biases, then we're never going to make the steps to change it. So I think that's one. And data certainly helps us do that. So we have to recognize that. But then we have to partner deeply with communities in a way that we haven't. And that's what I'm excited about, how North Carolina, our department has done things differently. We actually have an 80 plus person advisory group from historically marginalized communities that meets weekly. They've given so much of their time to really advise us on the messages we use, the messengers we use, how to tailor things. We've certainly tried to do everything we do in English and in Spanish, but it's more than that, right? It's making sure we have folks who are trusted from those communities. Because look, if you've been neglected and ignored for decades, why would you start listening now? I totally understand that. So we have to get to a place where we can rebuild trust, because I think it's been broken, and understandably so. And so you can't just build trust overnight. You have to do the work of partnering deeply, and listening and doing things differently. And that's hard. I will say we're not perfect at it because we're in a crisis. We want to move fast. We want to get right. And moving fast, sometimes meaning to do things the way you've always done them. And you kind of have to, and my team reminds me, because I'm the go fast person, that we have that building trust takes time and deep partnership and listening, and that's not always compatible with fast. And so I think we just have to acknowledge that and find that right balance.
Dr. Cohen, thank you so much for that presentation. I know I learned a lot from it. And thank you also for keeping our community safe across North Carolina, leading us through this incredibly difficult time. This has been an enormous challenge, and you all, I believe, have met it. One quick aside, though, Dr. Cohen, I can totally relate to your well placed shout outs to your mom and kids because I do that all the time. I look for
Yeah,
chances every chance I
exactly.
get to shout out my mother. So
Yes.
thank you
All
so
right.
much again.
Thanks, Lena. Good to be with you this morning.
So as we move on, before I introduce our panelists, Remember, you can submit questions within the chat box. It's on the control panel on the side there for webinar. I would like to introduce our panelists from 3 major healthcare systems in the region. We're very excited about this group of experts. Our first panelist serves as the president and CEO of Wake Med Health and Hospitals, Donald Ginsig. Mr. Ginsig, please join us on screen. We are now pleased to welcome the interim president for Duke Raleigh Hospital, Lee Bleeker. Ms. Bleeker, please join us. And our third panelist is the Chief Medical Officer at UNC Rex Healthcare, Dr. Linda Butler. Great to see you all. Thanks so much for taking time to be with us today. I know you are very, very busy, as Dr. Cohen just broke down their hospitalizations at an all-time high. But I wanted to begin our conversation by hearing from each of you on the status of our healthcare systems as COVID-19 continues to spread in our community. My question, and I'll begin with you, Ms. Bleeker, can our hospital systems right now handle the current surges that we're seeing? How is PPE procurement at this time? How is your system handling the high number of infections?
Thank you, Lena. Our healthcare system at Duke Health has been phenomenal in planning during the last several months on the surge and what we would anticipate. So we have the capacity and the plans, if needed, to implement additional bed capacity should a surge come. At this point, over the last several weeks, we have not seen specifically at Duke Health increase in cases. We've been fairly stable and steady with the number of cases that we've seen across Duke Health. I know Dr. Cohen mentioned that we will have another higher number of cases reported today across North Carolina, but we have not seen that across Duke Health. You know, we continue to implement different strategies as far as telehealth to reach patients differently. Prior to the pandemic, telehealth was not at the forefront of healthcare. So we're very excited about what that has brought with COVID. In addition with PPE, so we have had challenges over the last several months with PPE. However, at Duke Health, we've implemented several different processes and procedures on how do we make sure that we have enough PPE to keep our team members safe. And we have a system now that we've implemented across all of our Duke Health hospitals about the reprocessing of N95 respirators and masks to make sure, because in the beginning of the pandemic, that was a significant crisis for us and not being able to have enough. So now we have a process that allows us to repurpose or reuse those masks based on a sterilization technique that's been FDA approved. So we're very fortunate to have great leaders in our healthcare system that allow us the opportunity to do those initiatives. We continue to work on, expanding visitor hours and really making sure that we're working on visitor restrictions and what that looks like. But, to Dr. Cohen's point, masking, hand hygiene, social distancing is really at the forefront of all that we do for all of our patients, our visitors that enter our facilities. We're required to do all that, as well as our team members.
Dr. Butler, I don't know if you want to answer that question as well or move forward.
Sure, you were muted for just a second, so I couldn't hear your question. We're in a similar situation to Duke Health. We have 25 COVID patients in-house at Rex today. The number across the healthcare system has gone up slightly, but it is stable. We have staff who are COVID positive, and most of those have been community acquired. So I echo Dr. Cohen's concerns with Thanksgiving coming and people wanting to spend time with their family, that may cause more of not only a bump in patients, but a bump in COVID positive staff. And then, we are challenged right now with having a full hospital. A lot of our other patients have returned, and because they're avoiding the emergency room until they are really sick, the acuity is much higher now than it was even pre-COVID. So we have COVID patients, which are not really overrunning the facility by any means, But then we have a lot of other sicker patients, so that hospital's full, acuity is high. I think that our system, we have a predictive model, has us peaking at 60 patients about a month from now, and I think that traditionally the system has us peaking higher than where we were, because our July or June peak was not quite as high as they had predicted in the model. So I think we're in a good position to handle the increased number of patients. I think our bigger challenge will be staff to care for them if people don't follow the mask and social distancing and hand hygiene guidance. One thing that we've done is also use the same FDA approved method for reprocessing or sterilizing the N95s. We have not even had to put those back into circulation yet. We're still using the supply that we've been able to get. But I think if there was one lesson learned from this pandemic, all three systems worked closely together to try and prepare PPE for their staff, to protect patients and staff. But I'm hoping that we're going to diversify our supply source and manufacture more within the U.S. Then we're not going to be as dependent on other countries for our supply.
And Mr. Ginzig, I'd like you to answer the same question, but just to Dr. Butler's point there, I mean, how did the rush for PPE and for any type of therapeutics in the spring and the summer prepare you for now, where we're seeing such a surge? I mean, what did you learn from that time, and how did it prepare you for now when we're seeing so many people?
It helped temper and harden our efforts along those lines. A lot of coordination. Again, it was the Wild West. I mean, you were ordering personal protective equipment from suppliers you never even heard of. You were taking a chance. You expected a certain amount of fraudulent stuff to come in. We developed a great relationship with NC State, where everything we were able to order from alternate vendors, we were able to test and verify that it wasn't an N30 when it was projected to be an N95, and those aspects. We innovated a lot. We shared among the health systems. When you were low on X, we shared what we had. When we were low on pipettes, they shared what they had. We learned that personal protective equipment grows in terms of the challenges along those lines. Things you never thought you would be short of, like pipettes in the laboratory you needed to be able to do the COVID test, or gloves, for that matter, is kind of the new mask in terms of everyone has gloves now. And everyone's buying gloves, and you can't go anywhere without somebody wearing a gloves. And so health systems have had that challenge as well. Coordinating national stockpiles, yes, some of the challenges working with the state on those distributions. We're fortunate in our areas, and that each of us participate in regions that respond to disaster. We've been in training from H1N1 to Ebola, so we had those protocols in place. This was, as you heard earlier, unprecedented, as you have said, but I think it also allowed us to really build upon what we do every single day, which is respond to the needs of our community. And our teams and our organizations get up every day and deal with whatever comes. Our staffs are amazing. Personal protective equipment and those aspects, we innovate and adapt and overcome any challenge that comes down in front of us. And at the end of the day, I think deliver some of the best care to our communities that you'll find anywhere in the country.
I want to follow up with what you just said, Mr. Ginzig. I'll ask you. You talk about different healthcare systems sharing items, sharing equipment, sharing PPE. Were you competitors before? Could you have imagined that systems would have done that before this crisis?
I'll be honest, yes. Uh, you know, we compete where it makes us better and we collaborate where it makes our community. And I hate that sounds trite, but it really is true. We share practice protocols, we share policies, we share innovations that each of us are doing. Now, we obviously don't give Rex the best stuff when they ask for it. No, I'm just kidding. We, we really do. And our clinicians collaborate and work together all the time on a variety of things, whether it's the latest protocol on X or the latest technology. These are results on a piece of equipment that we're working on. We're part of group purchasing organizations together to help lower the cost of healthcare for our communities and get the best outcomes. So I'd like to say we had an epiphany because of a national crisis, but really it's embedded in the healthcare ethos, which is we get together to help heal and treat and make lives better.
Dr. Butler, a little bit on the innovation and how you all have utilized technology, how you've utilized technology in a way that you may have thought would have been years down the line, but because of the issue or because of the pandemic, you've had to accelerate it. So, what aspects of the pandemic have forced advancements where maybe before it would have been slower to happen?
Well, Dr. Cohn mentioned telehealth, and that's probably what has had the largest or most rapid adoption on both the patient side and on the provider side. Getting some of our more senior patients to do a televisit has always been a challenge, but when they fear coming in and being exposed to COVID, then they overcame their fear of technology to protect themselves. So we did have an increase in that, and that it was okay to telework. We are a very collaborative group in healthcare, and you always want to be in person. And it was getting a certain segment of your coworkers to say, you know what, you can stay at home and provide great service to patients and just do it remotely to protect yourselves and to protect us. We also had a lot of great dashboarding work because your supply chain, to be able to know who has what. You would think we would know that inherently, but there wasn't really the ISD infrastructure to do that. So now there's a dashboard, so we know exactly how much of everything we have, and we set up a mechanism for sharing equipment, even within our system, or like Mr. Ginzig said, across the other hospitals as well. I think necessity became the mother of invention, and partnering with the universities that are not necessarily in healthcare, like NC State. We use them as well, and being a state engineering grad, they're one of the first ones we went to when we needed max air shields and couldn't get any. They figured out how to make them for us, and they worked with our intensivist to create an intubation box because there was a lot of concern that during CPR people were being exposed, and so they created this box. And I don't know that it'll be manufactured beyond now, but it was something that they were willing to do for us, and just making general masks and testing. Also, I will admit, we're thinking outside the box that the vet school uses the exact same ventilators as we do on our patients. And we did have an agreement that if we had this huge surge, that they were loaning us some of their ventilators. And you would have never done that previously, but you start thinking outside the box when you're concerned that you may not be able to meet the demand.
Ms. Bleeker?
So yeah, just to add a little bit to what Dr. Butler said, obviously telehealth has been at the forefront of all that we're doing, but we've also had to implement technology tools to how do we communicate with the COVID positive patients or the potential COVID positive patients, both with them as well as their families. So when at one point, all three healthcare systems were not allowing visitors into our facilities. So how do you communicate with family members who are on the outside of the hospitals and your COVID positive loved one is inside? So using iPads and technology, we actually partner with our School of Nursing to work on a device that we call a robot that we call Jammer, which is actually technology that can go into a patient's room and you can connect in, and the healthcare worker that may not be physically in the room can actually see you, can talk to you, and assess your situation without a mask, which is unusual these days when patients can actually see a healthcare provider without a mask. So really partnering with our schools to really get technology at the forefront on how we communicate with patients and their families, just continue to prevent exposures to our team members to help keep them safe so they can continue to provide the great care that we provide today.
And do you think if this didn't happen, I mean, obviously this particular technology is for this particular issue, getting to a COVID patient and having a face, but even in some of the other advancements, do you think that they would not have happened if it weren't for this crisis?
I think it would have taken more time for it to develop and actually get to our patients and our team members. I think it would have always come. It would just have been delayed.
Mr. Ginsig?
I would say portions of it have been in place for a while, and we've been expanding from what we call an EICU, which is using much of that technology where you have a highly trained in intensive experts in both nursing and the physician community being able to monitor and assist from high intensity care to the little monitoring that we use to reduce falls risks, right? Somebody to watch somebody that's a fall risk to encourage them to get back in bed. We've used that technology now to communicate with patients and family and those sorts of things. So I would say the way it's being used would not have happened as fast without the stress of a pandemic and rolling those things out. But much of that technology was being used in healthcare to make it safer and better and expand resources to a wider area. This helped accelerate it. And people say, oh my gosh, you were able to do things in a week that you've been working on for years. And that's true on most anything. If you clear off your desk of all the 10,000 things that we work on every single day and just focus on one thing, you're able to do amazing things. And our healthcare delivery system, really, they're about innovation. They're about doing the best thing. And you give them a problem and they will figure out a way to scientifically innovate and measure and make things better. And so that's what you're seeing, especially in the Triangle, where we tend to attract very committed people, some of the best and brightest minds and the biggest hearts in what they do. And the fact that we live in one of the most amazing places on the planet helps attract folks.
Do you think there was a resistance to rolling out new technology in hospitals? Dr. Cohen actually talked about it a little bit, rolling out new technology in hospitals quickly, but now having been through this experience, there's a realization that you should just try it.
I would say that that's been there. I think this helped accelerate a lot of that. And so really it gave us one particular problem that created other problems that we got a chance to try to solve. And so as you heard from Ms. Bleeker and Dr. Butler, we sat down, all of us, and shared the best way, right? So PPE is short, and you have to go in and out of a COVID positive room 30 times. Okay, how do we make it so that the things that our nurses and caregivers have to check on are outside the room which reduces the amount of time to have to don personal protective equipment and go in. The ability to create those monitors and those communication devices, a lot of innovation around doing things that allow PPE reductions, family innovation around proning patients who are COVID positive, have them on a ventilator, don't have them on a ventilator, use remdesivir, when to use steroids in those. This has all been extremely embraced in our community, especially with the amount of research and exceptional care models that we have in this area. And so I would say that's been who we are, but this really gave people a prime directive on figuring out the best way. I think it's why, to be honest, in the Triangle, we have some of the lowest COVID mortality in the country. I mean, you take a look at what Spain and Italy and New York saw at around 20% mortality. We're down around 10%, 11%, 12% here. And that's not by accident. That's been a very coordinated effort and the best minds sharing what we're doing.
I want to talk about the Triangle's healthcare systems. That was a perfect segue. Ms. Bleeker, how do you see the healthcare in the Triangle standing apart from other cities in the U.S., other metro areas in the U.S. in terms of how they collaborate, how they innovate, and how they treat their patients?
A great question. I think the Triangle is very unique compared to other metro cities in the U.S. You know, in our community, we have a premier global innovation center with Research Triangle Park that not all communities have. And so all three healthcare systems are able to connect and partner with this global innovation that we wouldn't be able to do if we didn't have it as easily. You know, I think our Triangle area far exceeds the healthcare delivery models as compared to other U.S. cities. We have both the intellectual and financial resources right at our fingertips to really help develop and promote and respond to a shock like COVID-19. And so I think as Dr. Butler and Mr. Ginzig had talked about, you know, we have really collaborated not only with the healthcare systems in the Triangle, but with Research Triangle Park and others in the community to really advance what we're seeing and how do we deliver healthcare in high quality in a different way. It's been phenomenal to see it work, and you know, like some of the things that we've done with the emergency management response, working together across the county and with the different teams in the county to really develop what that response could look like if another surge comes or a bigger surge comes. So it's just been phenomenal, and I think we are very unique and set up very well to succeed, which to Mr. Ginzig's point, you know, we've had lower mortality because we have so much at our fingertips in the community.
Dr. Butler?
I couldn't agree more. It was very well said. I would highlight that we do have a really close collaborative relationship amongst healthcare in Wake County and with the government at both the county and the state level. You know, we work very closely with the health departments and also EMS. EMS is always at the table and willing to you know, come in and think through how to manage patients more efficiently in the county, and that's, you know, that's a blessing to have, and I don't think they have that in every state or in every county.
Mr. Ginzig?
Just to agree, I think we're very fortunate that we have both the academic, the research, the quality of life, the population that's growing. We have this amazing culture of welcomeness, whether it's from the fact that we have the research park that's been around 30, 40 years, bringing people from all over the planet to our little oasis of wonderfulness, and that acceptance and that ability to work together to innovate and try new things. The fact that we're the state capital and we, you know, get a chance to be kind of an area across North Carolina, which is an amazing growing state as well, and how that then leads to both, you know, governmental, manufacturing, education, research, pharma, banking. I mean, all of the things that give people a reason to come to our area allows us to work together to improve their health and their lives. And you know, Wake County's the healthiest county by many measures in the state, a state that isn't the healthiest state in the country. But I think that's not by accident. Yes, it attracts folks, but I think it's the fact that our healthcare communities work so well together, and that we've been able to see that.
Taking a couple questions. One I think is a really good one. Dr. Butler, I'll pose this to you at this point. How are you addressing concerns for the many people that are worried about the initial side effects of the vaccine? How are you already beginning with that messaging?
So, being a retired pediatrician, you never let the opportunity to vaccinate anybody pass you by. It is probably one of the best things we've done in medicine is to prevent illness. And every vaccine has side effects. And from what I've read on the Moderna and Pfizer vaccine, you know, the second injection has some soreness at the injection site. That is pretty common amongst all vaccines. I mean, it's a shot and you're injecting something, it's going to cause some muscle soreness. And the tenser you are, the more sore you will be. And, you know, it's a kill vaccine, so you should not experience a lot of side effects to where you can't go on with your usual activities that day. I will always take my chances with the mild side effects of a vaccine over the chance of contracting the illness that it's going to prevent. So, you know, I would, if I were at the bedside, I would line up to get the vaccine. I do not have any concerns over getting it.
Ms. Bleeker, are there plans at Duke Health for sending out physical materials, pamphlets, informational materials to people about the vaccine? I mean, how are you all planning on just purely messaging, getting the right information to your patients?
So great question. So we have a communications team here at Duke Health that will work with our providers and our clinicians to really message this really well, because as Dr. Cohen mentioned, it will take several months to get a widely distributed vaccine. But our Duke Health experts will review the safety and efficacy of the vaccines, or the vaccine that may come out, and work with our communications team on what does that messaging look like, both to our team members as well as our patients. And really making sure, you know, that we know that it's a safe vaccine, and then how we distribute that, and, you know, answering those questions as to when you'll have it available and why we're distributing it in the order that we're distributing it, who gets it first and who gets it second and who gets it third. I think will be an important message that our team will have to communicate delicately and very effectively.
Mr. Ginsig, what are your conversations like with the business community in talking about a healthy community is good for business? How do you communicate that? What conversations do you have?
So I'm honored to also be on the North Carolina Chamber board, and so clearly one of the key aspects is health, and healthy employees work better, lower costs for business, and we are both a deliverer of care, but we're also a business. We employ people, and I want a healthy workforce. Everything that we've done as an organization is to help our staff get joy out of what they do, but also live healthy, productive, and lives along those aspects. So we are both a deliverer of care, but also a business focused on keeping our team members and their families healthy. And so what we do together around this is critical as helping the business community do what it does. We've seen the impact, as Dr. Butler talked about, when you shut things down, people lose their job, they lose hope, they delay care. We've seen the second and third order effects of that. And so the purpose of what we've done hasn't been to, by wearing masks and washing hands, you are not going to stop this virus. It's a virus, it's really small. This is what they do. All we've worked on is slowing the spread to allow our systems and businesses and families to not be overwhelmed, to buy our incredible researchers the time to develop a vaccine. And I think in North Carolina, we've done an above average job of that, but it's educating the business community that by them wearing masks and washing hands, it helps them stay in business, which allows their employees and their customers to have access to all of the wonderful services that they provide. So it's not working against them, that we're not trying to shut them down, but by them following the best practices that are out there, it's good for them in the long run. And the healthier their employees are, the healthier our state is, the better their business is in the long run.
And Dr. Butler, maybe after you've expressed that to a business owner who may have been opposed to wearing masks, and maybe they were still resistant to it, I guess what goes through your mind at that point, if someone is still resistant to some of these measures that you're asking them to follow?
You know, thankfully, I just don't see as much resistance in Wake County. We have a population who really does want to care for one another, and when they understand the reason why, that scientifically we can show that you slow down the transmission of the virus by washing your hands, by wearing a mask. We do our part too, where we have made our flu vaccine deadline for our coworkers earlier. Usually it used to be, oh, well, in December, you need to get it by then. We made it November 3rd because while the vaccine is not 100% effective, if you do get it, you are just not as ill. And we try and share that information. There are some people who they are just going to have their opinion. And all you can do is reiterate the message and hope that you've got 95% of the people wearing masks, then the other 5 won't do as much damage. Just like we have people whose religious beliefs are, we're just not going to vaccinate our children, or we're going to not vaccinate ourselves. You're not going to change that person's mind. So just keep sharing your message and impact those that will listen. And overall, then we'll be protecting, hopefully, the entire community. So that's all I can say.
Final thoughts from all of you, beginning with Ms. Bleeker. How can businesses help support healthcare systems during this time? What can they be doing to support your messaging, support your efforts? What can they do?
So I think it's really important for the business community to continue to partner with us and with the healthcare systems, and to hopefully implement the practices that are evidence-based and that are safe. But it's been great. We've done some efforts in getting out into the community and education materials and COVID packets that have, masks and hand sanitizers and all of that. We're really doing more of those partnerships for those higher risk communities on how do we make sure that we're educating folks, providing materials in Spanish so that they know the signs and the symptoms, and just being really great stewards of, what we're doing every day, and hoping to stop the spread as fast. And it's going to take all of us to do that, not just the healthcare industry.
Mr. Ginsig, I actually wanted to say one thing. I thought about this fabulous organization that we did a story on yesterday, where they were providing COVID boxes to people who were infected with COVID, that had food, that had PPE, that had something that was just a nice little token that they could give them. I mean, are these the types of things that would help you all just in overall wellness in businesses coming up with maybe services like that to help the community?
Absolutely, and I think our communities have really done an amazing job. We know that that this virus has impacted people of color and of socioeconomically challenged communities at a higher level than economically advantaged communities. And we have worked health systems together, community organizations, faith-based organizations, to really both educate, build trust, because again, many in those communities feel isolated and disadvantaged and unaware of a lot of what's going on, but also really educating where they live, getting personal protective equipment out, access to testing along those lines. We've worked with the state and the county and a lot of organizations to be able to do that. And as an organization like Wake Med, who really is the safety net hospital for all in our communities, and both Duke and UNC are safety nets in their communities as well. That ability and what we've been able to do to be proactive, partner with business, because again, they're our future workforce, right? And so as we work to both educate, address disparities, but also help them live healthier lives in the long run, our business climate here is going to continue to thrive as it has over the last 10, 20 years.
Dr. Butler?
I think I go back to what Dr. Cohn was saying, that we need to partner with business to focus more on health and the community's well-being, and address the social determinants and the disparities, like both Ms. Bleeker and Mr. Ginzig said. If we are really successful, it's counterintuitive, but we would actually not need to have as many healthcare facilities. People would be living healthy lives at home and just come in briefly for their elective procedures and go home. That we would be addressing all of those other social needs. 80% of your health happens within the four walls of your home, and we need to make sure that people have a healthy, supportive environment to flourish in. So I think that is something that we can aspire to. It's going to take a long time to get there, but no one entity can do it on its own. I think if we have private-public partnerships between healthcare, business community, and our government, we can get there.
Thank you all so much for being with us today, and just generally, thank you for your care, for your persistence, I know you all are exhausted and you don't get to stop. You have to keep going. So we very, very much appreciate all that you're doing to solve the problems of 2020, which are alive. Thanks for being here today.
Thank you.
Now I would like to turn the program over to Carol Wagner, the area president of Gallagher, to introduce and then moderate the next panel. Carol?
Wonderful. Thank you, Lena, Dr. Cohen, and all of the panelists that we just heard from. I loved Mr. Gensig's comment about WakeMed's responsibility is not just to the community and keeping the community healthy and safe, but also ensuring that the employees at WakeMed come to work every day with that same confidence. And really, I think that's a perfect segue into our employer panel this morning. So I am pleased to have an esteemed panel of local employers here joining me to discuss their adaptation to a rapidly changing healthcare world and talk about programs that they've implemented to help their employees integrate new technologies and innovations into what I call this next normal while we're still dealing with this situation. And if you have questions for the panelists, then please submit them in the chat box. We are going to have a Q&A after I ask a few questions and we hear some opening remarks from the employers. So please make sure that you submit those and we'll get to those as quickly as possible. So now I would like to start introducing our next panel to you. Please join me in welcoming the President and CEO of HH Architecture, Kristen Hess. Kristen, will you please join me on the screen? Wonderful. There you are.
Good morning.
Good morning to you. And next we have the Senior Vice President and Triangle Area Executive of First Citizens Bank, Jay Irby. Will you please join me on screen?
Morning, Carol. Good morning, Kristen.
Good morning, Jay. Welcome. And finally, Senior Vice President and Raleigh Site Lead for IHS Market and current Raleigh Chamber Chair, that is difficult to say, O'Hara Mackin. O'Hara, I see you've already joined us on screen. Welcome.
Good morning. How are you?
I'm great. And thank you, everyone, for joining us today. So to get started, I'm going to ask each of you to share some transformational healthcare changes that you as employers have made or that you are making to meet the rapid change in delivery of healthcare services to your employees. And Mr. Irby, I'm going to begin with you and then ask our other two panelists to follow you.
Sure. Thanks, Carol. And thanks for allowing me to be a part of this obviously incredibly important healthcare discussion. I want to start by saying that I've had the pleasure of seeing firsthand. I've got a sister who serves as a nurse at UNC and a wife who works at Duke Hospitals, so I can attest, as all of us can, to the level of healthcare areas that we have in our community. We are so proud to live in this community and to have the level of healthcare that we can provide. We at the bank have really continued to improve and enhance our benefits program, and that is continuing. Like covering the cost of COVID-19 testing and treatment, covering telehealth at 100%, expanding our employee services, and that includes some work from home resources for families. But I'd say that our biggest priority for us remains keeping a safe work environment. As you're well aware, the banking industry has been open throughout this entire pandemic. We've done this through education, through the importance of communication, obviously increasing our cleaning efforts that allow us to get our branches back open quickly. I think prior to 2020, there's some people out there that would not have thought about banking as being quote unquote essential, but this year, banks have played a major role in providing relief to business owners and to families. And given that level of support needed, we felt it was incredibly important for us to make ourselves available for our community.
Wonderful. Kristen?
Yes. We are fortunate to have an amazing team that has been willing to roll with the punches. Architects were considered essential as well. And we have been working like crazy to try to take care of our clients but we did have 5 projects go on hold, no thanks to COVID. And so trying to reallocate work, trying to be really flexible with everyone and touch base with everyone about their individual needs. We, early on before the shutdown, we worked on some tests on our server, not everybody had a laptop. We had to really look at everybody's individual home situation and devise a plan that was custom made for that individual, which was, a steep learning curve for some of us. A lot of people didn't initially want to work from home. So it was like trying to figure out how to make that comfortable for them. We have stayed open and allowed people to come in when they're comfortable, and we've put a lot of safety protocols in place, like Jay mentioned, in terms of really intense cleaning and so forth. And the biggest thing that I'll share is we're installing a bipolar ionization system for our mechanical system in the office. So we're actually getting ready to shut back down a little bit since we know how to work from home, and ask everyone to go back home, and we're going to put in this bipolar ionization that will render all the viruses and bacteria inert in the air real time. And so next year, we hope people will feel more comfortable coming back because of that. We're also installing a bunch of touchless and other things like that.
Wow, that's a great innovation. Okay, O'Hara, how about you?
Yeah. Well, Carol, thank you. And thanks to all of our sponsors and to the Chamber and everyone who helped us bring us together on this. Much like Jay and Kristen, we've done a lot of new things throughout this time in COVID. And I have to say, Friday, March 13th, when we all kind of went home for the weekend, not sure what was going to happen over the weekend, and Monday seemed so long ago. But just to give you context, we're an employer of about 16,000 people globally. We have about 400, just under 400 here in the Triangle, and we've really focused on continuing to connect our employees, leveraging technology, really creating an environment where everyone feels that they're in the room and they're part of the conversation, which has been one of the nice side effects of this move to remote working. We've also invested a lot in well-being and giving people the opportunity to get the support that they need through our health and welfare benefits, but also to support each other and give kudos to each other. So we launched a new people hub throughout COVID, which has given all of our employees one single source to go to for health and well-being, for financial needs. It's also, and what's been really exciting to see, it's been leveraged for colleagues to really share stories about people they're working with and the cool things that they've done, either from a business perspective, from a personal perspective, and really just bring people together in new and unique ways. And the last thing that we've spent a lot of time focusing on, because it's been important to our staff, is diversity, equity, and inclusion. You've heard it mentioned a few times throughout the morning about equity and making sure that we're really we're thinking about people entirely and all the different situations that they're coming from and giving them the tools to be successful, whether that's at work, whether it's helping to manage kids with school while you're at home, whether it's managing other things going on in the home, and really supporting our employees through that. So.
Now, was your workforce remote, O'Hara, or I'm sorry, essential? I heard the other two automatically categorize themselves as essential workers, and I'm just curious about your workforce.
We were not considered essential workers in the case of how everyone else was. That said, our clients do rely on our employees day in and day out, so we had to work very quickly to make sure that colleagues were as effective working from home as they were in the office, that they were comfortable. So.
Okay. Good. Just wanted to clarify that for our audience. So we have a couple of different perspectives. Employers who were, from the very beginning, considered essential and really in the office as quickly as time would allow. And then employers who still have employees at home. Maybe on this call today, they're still dealing with the challenges of a remote workforce. So I want to make sure that we speak to both of those as we go through our questions this morning. And O'Hara, you actually set me up well talking about investments in well-being. While the first part of our program has really focused on health and health care, I want to shift now because we know that not only have our employees been impacted physically by their emotional health as well as their physical health, but they've also experienced stress in their homes with regard to financial well-being and even their career well-being and the broader issues that are associated with that. So I want to ask all of you a question right now. Looking back, whenever we went in to 2020, things looked a little bit different whenever we had a tight labor market, particularly here in the Triangle. Well, since March, we've seen that start to unwind a little bit. We've seen increased furloughs, workforce reductions, hiring freezes, changes to salary budgets as employers have been shifting their focus more to sustainability. And so what have been your immediate challenges and the long-term impact to your business? And I'm going to start with Kristen with this question.
Thanks, Carol. Yes, as I mentioned, it has been a challenge. We have retained every single employee, and we're really proud of that. We did get the PPP loan. We're very grateful to that. But what we did is we had to take a really hard look at next year's financials. You know, this year is still slated to be a really good year. Next year looks not so rosy. And what could we do now to try to prevent any massive problems next year? And we spent a lot of time reviewing budgets, reworking spending plans, and then we had an all hands meeting. This was a little bit scary to do, but I felt it was necessary. And so we actually invited our whole staff. We usually do a state of the firm in January, but we said, look, we need to have a state of the firm right now in August. And we need to tell you that next year looks like a big challenge, a big hurdle. And we showed how many projects we have now and how many projects will be, you know, until we win new stuff, what next year looks like. And we really shared with our entire team, here are the ways that we're cutting spending right now so that we don't have to cut positions. And, you know, we're a firm that likes to enjoy meals. we're a firm that likes to get together and have cake and have all employee meals for all sorts of, you know, you name it, and we're ready to celebrate. So we had to let everybody know we're not going to stock the break room. We're not going to give quite as many gifts. We're not going to be able to do some of the things that we're accustomed to. And that's hard, but everybody, to my delight, was so receptive and appreciative. We got so many compliments for our transparency and what can we do to help. You know, not trying to scare everybody, but look, everything's uncertain and everybody knows it, and it'd be better just to have it out there. And it was remarkable the way everyone came together and said, hey, I could help out with marketing and other things that I typically don't help with. What can I do? How can I be more efficient with my time? You know, and so it was just a great way for us to come together. And it felt risky into it, and now we feel some relief knowing that we're all together in this.
Right. So you mentioned early on you were a recipient of PPP, and I'm looking at Jay because I know as a bank, his company First Citizen certainly played a big role in that. And so Jay, I would expect that your immediate challenges and maybe even the long-term impact is not the same as it is for someone in Kristen's shoes or O'Hara's shoes. So could you address that from the bank perspective and what you saw?
Sure. And just to reiterate, our number one challenge really has revolved around the importance of being able to keep all of our associates and our clients safe, because our clients need us more than ever. They need to have these conversations. They need this level of advice. Yes, you're correct. PPP, I'll use the word that we used earlier. We saw unprecedented demand for this particular product. And we got the information, really quickly, had to institute and execute on it very, very quickly. Now we're helping our customers through the forgiveness piece of it. All of these things, where we saw unprecedented demand, what our goals were was to help our clients and the community as a whole keep people employed, keep their businesses running and operating. So again, we couldn't have been done without the immediate keeping everybody safe, sure. But the biggest thing that we're focused on right now is just helping clients, not only with PPP funds, but there's a lot of other things that are out there that can help sustain their business, access to capital, access to liquidity, deferrals if needed, working with our customers and just being a good stewards. So you're correct, the PPP played a major role, but there were many ways in which the banking industry as a whole was able to help other businesses through this pandemic.
Great. And so I'll ask O'Hara the same question. Immediate challenges and long-term impact to your business coming out of this?
Yeah, sure. I guess there's a number of immediate challenges, but two that were really important to us was one, how do we engage with our clients, right? Our clients are going through the same challenges that we're all going through. They're desirous of the information and the intelligence and the tools that we and others have been providing them. So how do we continue to deliver at the same level we have historically? And it was really exciting to see how our employee base came together to deliver on that. And it goes back to some of the tools that we talked about before to allow employees to engage with clients remotely. The second is as it relates to our employees and what we did as one. We did go through some reorganization at the beginning of COVID. I think we did a really good job of putting robust support around employees who were impacted. And then there was the challenge of how do we bring new staff on as we're staffing up for initiatives that we're moving forward, and doing that in an environment where you can't have employees come into the office for interviews. New employees aren't coming into the office to get this sense of the culture, and then starting to wrap some new ways of engaging around that. So someone can come in, they can get plugged into the organization, and quickly start to have the impact that we knew that they could have. So those were two big challenges for us that I think we navigated quite well.
So can you share some examples, new ways of engagement? So I know early on in March, we were all just trying to figure out how to operate Zoom, right? And I saw virtual happy hours, all kinds of events going on in our workplaces to make sure we had people engaged. And at least what I saw was after about 2 or 3 months of that, people were over it. So now that we're at the end of the year and 8-9 months later, are there new things, surveys or other tools that you're deploying, or even third-party resources to help you with that remote workforce and keeping them engaged? And that question's a follow-up for O'Hara.
Okay, that's a really good question. Yes, the Zoom cocktail hours definitely lost their luster pretty quickly. We've and I'm sure like everybody, we've evolved as we progressed through the year, and we found out what works for employees. We've done a lot of the way of surveys to understand what's on our employees' minds. We've done a lot in the way of mentorship to put support around our colleagues. And the other thing that we've done is we've in many ways accelerated some of the things we did before, such as innovation months, where we bring employees together from different parts of the organization to come up with new solutions, both to internal challenges we may be facing and then opportunities that we see in the market. So it's constantly evolving how we're engaging people collaboratively, and then also how we're engaging on a one-to-one basis. One of the things that I've found over the past 9 months, I've probably interacted with more colleagues globally than I would have normally throughout an entire year, because you lose that, when I'm in Charlotte or when I'm in New York, we'll connect. It's like, let's just connect, right? And let's just do it right now. So there's been a lot more of evolving from that, the group activities to more one-on-one discussions with people about really what's going on and what are the opportunities or challenges they're facing.
Thank you. And I'm going to ask Jay the same question insofar as engaging employees, because again, your employees have been back at work for quite a while. You have clients now coming back into the bank, I guess, in some cases. And you talked a lot about really assuring your employees and the public your safety standards that are in place. But aside from that, how do you engage your employees who may feel like, gosh, everybody else I know is still working from home. Maybe even my spouse is working from home. I'm not sure this feels safe to me. What are some things that you've done there to address that with the employees and really keep them motivated coming in on a daily basis when they hear and see so much of the world maybe is not acting that way?
Yeah. Well, I think the most important thing as leaders is we have to be present. We have to be able to be adaptive. We've got to react quickly to this changing environment that we're in. One of the things that we instituted was a lot of different communication channels. We have both a online portal channel. We've got virtual meetings. We've got different ways in which our associates can get the needed information to serve their clients. And I will say this, our clients have been wonderful, as I'm sure all of them have been, so we take a lot of pride in the fact that the things that we've done every day has had an immediate impact to the place where we live, work, and play. Having said that, an important thing that we do is we've got to make sure that we deal with the facts. We can't make any assumptions. So we've got to communicate what's going on in our community to make sure everybody's got the resources they need. Again, we've got to connect with people differently. We've got a lot more virtual meetings, as O'Hara talked about, and we've got to listen to to our associates to make sure that we understand what their concerns are and address those as quickly as possible. And then the last thing I think is important is that we've got to be innovative and creative as we think about ways to have fun at work, because people want to have fun. People want to be in an environment, a team environment where they're doing good work. And so we've created contests, we've created different ways to motivate and our sales folks. And so it's been a challenge, but I think it's been rewarding, and I think it's something that will carry on into 2021.
And Kristen, anything that you would add to that?
Yes, we sent some fresh fruits and veggies to our staff, and we have sent some personal. I know, like O'Hara, I've talked to folks on a different level, gotten to know our employees, and one of the things I'm really excited about, this year is our 15-year anniversary for HH Architecture, and so we were hoping to have a big party, and we were not able to do that, obviously. And instead, we took the money that we would have spent on the party. We asked our to designate the nonprofit of their choice, because right now nonprofits are hurting terribly too. Everybody's hurting. So what a great way for our employees to be engaged. They got to give charitably, and we got to learn about what's important to them. I mean, I learned about, folks that have family members that are struggling with long-term illnesses, or they used to, they stayed in the Ronald McDonald House as a kid or whatever. So it gave us an opportunity to learn more about our employees, to learn about each other, and to learn about new nonprofits that are doing great work in our community. So that was a fun way to re-engage and do something good that was sort of started out as a disappointment.
Great ideas here. Now I'm going to ask all of you a question that might make you a little more uncomfortable, because we all like to talk about our employees and what we're doing in our workplaces, but we also know that our teams go the way the leaders go. And so while all of you had plenty of notice for this panel this morning and we're really excited about the things that we were going to talk about, I know as a leader in my company that some days you just don't wake up feeling that way when you think another day that oftentimes looks like yesterday. And how do you stay positive during this uncertainty? What advice would you share with other leaders who are on the call today thinking, okay, we are now headed into month 9. So what do you tell your colleagues who are listening? How do you stay positive? Where do you go? What's your source? And I'll start with O'Hara.
All right. It's a good question. So I work at home, and this morning I was said goodbye to my wife and kids. My wife's like, have a good commute. And I think it was because she was just, like, don't trip on the stairs on the way to your office kind of thing. And I share that story because I think it's important for our colleagues to see that we're all human, right? And we do have a role as leaders. We also have an equally important role as colleagues and members of the tribe that we're all part of or the tribes that we're all part of in our organization. So I think being able to show the human side, show that we're facing some of the same challenges that our employees are facing, be able to get them to open up on what they're experiencing and work with them to find a good rhythm that works for them. And so, for example, we have a colleague who, really strong performer, was off for a little while. And what we finally realized is some of the meetings that were being scheduled was right square in the time when that person was dealing with children coming home from school, someone waking up for a nap, and we adjusted, right? But it took that comfort level for them to be willing to share with us what's going on. I think the other thing that's important, it's definitely important for me, is maintaining a sense of rhythm and consistency. So staying with being active, reading, continuing to do the things that we did prior to COVID in a way that is safe and allows us to be who we are and bring the value that we bring to our colleagues every day. But the most important thing is just being human and recognizing that we're figuring this out together.
Absolutely. Kristen?
Yeah, I would say that initially I was really trying to be a cheerleader. And then in August, it really hit me personally. I had a hard time just feeling like, could I get up and keep going? And one of the things that got me through is I like to play in the dirt. So I have done a lot. My husband says, you have lost your mind. I'm just outside all the time, gardening and moving stuff around. I don't even care if I just move this plant from here to there. But being with the earth has been really grounding for me, literally. And moving my body. So in August, I would say I hit my lowest point in terms of just not wanting to even go for a walk. And I had to really just focus on the dogs. Like, okay, I'm just going to walk the dogs because it's good for them. And then that sort of slowly got me going. And then trying to get back to doing a little more running or a little more with my weights or something. Now I'm back into my exercise routine and it feels really good. But if you'd have asked me in August, I didn't even know how to really start again. And so I kind of had to make it about the dogs or about something else. Like I'm just going to force myself to go for a walk or whatever. So it can happen to all of us so quickly without us even realizing it. So now I can say I get my strength from moving my body and from playing in the dirt. But we all go through dark seasons and dark times, and we don't know when it's going to hit us. And we have to be patient with ourselves and patient with each other.
Good advice. Okay, Jay, your strategy?
Sure. One of the things that I found that our employees love to hear is I have the availability of hearing from customers and from leaders in our areas these wonderful stories about how we helped somebody get their first house during this pandemic, or how we help somebody refinance and save a bunch of money, and or how we help somebody plan for the future, or whatever it may be. And we hear all these stories And it's important as leaders that we share those and we provide a forum to share them with all of our associates. I think that's what gets people up in the morning, especially for us in banking too. I mean, it's just to know that what we're doing is making an impact, because we see over and over again, the problems that we've talked about today, where people, don't want to wear a mask as they come in or whatever it may be, or having to adhere to policies. But when you hear stories where the things that we do actually impact the lives of people that we want to impact the lives, it's amazing. And so providing that forum is, and providing some best practices so that they can go out there and achieve that same kind of success has been a challenge. Obviously, we've had to do it a lot more remote. We've had to do videos. We send out videos. We send out video thank you cards to our associates. That's been really real fun that we've been able to do. And I agree with Kristen. And by the way, Kristen, congratulations on 15 years. That's amazing. And so, one of the things that I've taken up, we've asked our folks to really make sure that they take time and take their PTO. A lot of people can't travel and they don't feel comfortable traveling. So as a result, maybe they don't take that day of PTO, a staycation or whatever you call it. But we're really we ask folks throughout the entire process to take the necessary time that they need to refuel the jets and to make them as motivated as possible.
I often think it would be fun at the end of this year to have a bloopers reel whenever I think back some of the videos and our very early WebEx calls, virtual meetings and things, how just, I'm sure ridiculous we looked and sounded. I'm sure we would find that funny years from now. But I see your point. So we have a question on the chat box that I'm going to read and get your perspective on this. So this is from an employer, BHS, which helps companies develop and execute mental health and well-being strategies. And so there's a lot here, so pardon me, I'm going to get down to it. This attendee says that per the CDC Pulse survey, we are seeing a 300% increase in depression and anxiety. The CDC survey found that in North Carolina, 36% of North Carolinians are experiencing depression and anxiety symptoms. And so the question is, how are companies addressing the mental health needs of their employees, particularly as it regards to healthcare? And I would just ask either one of you to please jump in if you've addressed this in your organization and you have something that you can share with this panel, with this attendee.
I'll just start by saying we uncapped sick time. We used to have, a certain number of hours per year that employees got for sick time, and we just uncapped it completely and said, you need to take as much time as you need, and you don't have to be physically sick. You might be feeling emotionally or mentally unstable or out of whack, and your family may need your care as well. And we just need to, no questions asked, completely uncap it and not worry about tracking that right now. That is not our first priority. Our first priority is you as a human being. And then just flexibility in terms of when you work, but also making sure that we stress that because you're at home or because things feel weird, we don't, like you're not traveling or whatever, we do not expect you to work all the time. We really want you to really shut it off. And we had to say very early on, we're not going to have any meetings from 12 to 1. I mean, I can't tell you how that started to creep in really quickly. It was like suddenly the happy hours, but the lunch, and we had to say, do not schedule at lunchtime. You've got to, you might have to make a grilled cheese sandwich for somebody, but you also might need to just go outside for a hot minute and walk around and breathe. So anyway, just a few things like that.
Anyone else or anyone altered their actual healthcare benefits to address the anxiety, depression, mental health care of your employees? in this period.
Well, one of the things I mentioned earlier was the enhancements that we made to our employee assistance programs that we have available. That really kind of spawned from a associate survey that we did in the spring, right after the beginning of the pandemic. We knew that there were going to be support staff that were going to be working from home. We obviously had the issue of a lot of our associates have children who are, becoming teachers. I don't know if you know this or not, but they changed the way you do math. So I had to figure that out. And so there were some resources that we needed that could provide stability in the house, and for our associates, not only at work, but at home. And so sharing some of those best practices of making it available and transparent via the phone or via online is a lot of things. Again, it goes back to really listening to your associates.
Right. So unfortunately, our time is over. I could stay on here and talk about this all day long because I already have a short list. I've been taking notes as you guys have been speaking about things that I know I could implement, and I'm certain that our attendees have also gotten some really good takeaways. And so thank you again to the three of you, Kristen, Jay, O'Hara. It was a pleasure to have you on the panel and hear from you. And thank you for sharing your business strategy and outlook and also your leadership nuggets with our attendees today. Thank you so much. And at this time, I'm going to turn the program back over to Lena for closing remarks. Thank you, Lena.
Thank you so much. I wrote down a bunch of notes as well because that was a fantastic panel. I love Refuel the Jets. That is clutch. I plan on using that. Investing in the well-being of employees, that is critical right now. You know, I love that Kristen talked about how much her employees love to eat because at WRAL, put any free food in the newsroom, it will literally be gone in the next 2 minutes. So it's certainly providing veggies and fruit to your employees. I'm sure that was a big bonus and something I would absolutely love as well. Thank you, everyone, so much for joining today. I learned so much from our incredible professionals, both in the business community and in the healthcare community, learning about how technology is being used right now to continue to keep us safe, to treat the many people in our state who are in need of it. This has really been wonderful and compelling. Also to learn how the business community is having to step up and really think about caring for the person, not just the individual working for you, caring for the person and their mind. So thank you to everyone for your participation, for everyone who provided questions as well. Again, this will be recorded. Thank you as well to the sponsors, the presenting sponsors, Gallagher, Wake Med, Duke Raleigh Hospital, Platinum sponsor, Curie, the gold sponsors, Blue Cross and Blue Shield of North Carolina, First Citizens Bank, United Healthcare, our silver sponsor, Messer Construction Company, bronze sponsors, Baker Roofing Company, Young, Moore, and Henderson, and to our media sponsor, WRAL. I hope you all were edified by what you heard here. And please note there's going to be an upcoming virtual newly elected official series that's coming on January 14th and January 28th at 9 o'clock in the morning. You will receive a link also to the recording of this event in the coming days. Thanks, everyone. I wish I could see you to say thank you to your faces. Thank you very much. Take care.